Welcome to Healing at the Speed of Light. Every week we discuss how laser therapy is changing healthcare and how you can benefit. Now here is your host and founder of Laser Therapy Institute, Dr. Jason Roundtree.
Hello and welcome back to Healing at the Speed of Light. This is Dr. Jason Roundtree. I'm your host. We'll be talking today with a very, very special guest. We've got Dr. Jeff Nuziard on the line, and he's joining us remotely to talk about pain management, but also some additional benefits that laser can have. Dr. Nuziard is a UNC graduate, 2017. He has a PhD in Biomedical Science, and he's got quite the background in utilizing laser for many different things. So, Dr. Nuziard, thanks very much for joining us today.
Thank you for having me. I'm excited to be here.
Awesome. Well, we're excited to have you. So, you've got large, expanse of information and knowledge and experience utilizing laser directly. Would you tell us just a little bit about kind of your background with lasers?
This is a wonderful time to be alive. Science is just progressing so fast and so rapidly, and the whole world of laser medicine is a phenomenon that is just exploding and doing extremely well. When you can take energy of light or light energy and you can correct things like Dupuytren contracture or plantar fasciitis or chronic pain, rotator cuffs, whatever. That's exciting stuff where there's no downtime. And then you have this world of what's called photobiomodulation that is absolutely phenomenal. And actually, with the day and time we're living in right now, we're doing a bunch of testing in our clinic on the coronavirus. And we're using photobiomodulation and laser medicine to help people recover. It's been very exciting.
That is awesome. That is excellent. Wow, that's really great to hear. I should say that Dr. Nuziard runs a laser center in Texas, and you can find him by going to his website, sexualwellnesscentersoftexas.com. And we'll drop a link to that in the show notes as well as his phone number. So that's pretty exciting stuff. Tell me more about kind of what you guys are seeing then with some of the coronavirus patients. What kind of symptoms are they dealing with, and what are you guys kind of targeting?
Well, a good friend of mine, not far from here, is a PhD MD, and he noticed he is an emergency room doctor. He also has his own clinic, but he's gone back and worked the emergency room during this time for a little bit just to help out. And what he's noticed is that by the time you get on a ventilator, your life expectancy is about 2 days once you get intubated. So he started saying, it's not ventilators. It's not the shortage of ventilators that's the problem, because they're flipping over so fast. So he kept doing some more research, and he realized that people's heartbeats started getting a little more erratic, but their lung capacity was fine. And so he said, it's not a lung disease. This isn't affecting or constricting the lungs at all. He did some more research on it and called me and said, what do you think if I tell you that this virus is attacking the medulla and basically short-circuiting your brain to where it's telling you not to breathe properly? And he noticed all of his patients were going into like a spasmodic breathing pattern before they would end up getting on the ventilator. So at first he brought a couple patients in that were getting close to needing to go on a ventilator, and he just got this idea. Him and I have done a lot of research on photobiomodulation and how it works. And so 3 patients that were really sick, we went in for a laser treatment of about 5 minutes on the back of their throat using a long pulse, extra long pulse in the seconds regime pulse duration, to where it's a 5-second pulse duration, 4-second pulse duration, and used an Nd:YAG beam, and to be able to create that photobiomodulation effect. And in 24 hours, they were completely symptomless.
That's fascinating. Holy cow.
Unbelievable. Went from completely symptomatic to asymptomatic in 24 hours. Wow. So now we're at 10. We're 10 for 10. I've treated some, he's treated some, we're 10 for 10. And it's very, very, very exciting to see. And that's just, again, the power of light. It's amazing what you can do with energy. Photobiomodulation has been around for years and years and years. And it's treated things up until The laser that I use, you've had to use an 810 diode laser and actually go to different points in the body and surgically put the laser in, like on a femur, to extract bone marrow stem cells or something. What we're doing today is completely different, and it's a low-level laser therapy that we can use a long pulse duration and get tremendous results, whether it's for erectile dysfunction, which we do a lot of that at our clinic, vaginal dryness, vaginal tightening, stress urinary incontinence, ejaculation issues, whatever. We've been able to treat that all with the laser, and it's just been really phenomenal. Again, using the powerful tool of biomodulation.
That's fantastic. I know a lot of patients initially, when they hear about laser and utilizing laser, their initial thought, first thing is, oh, what kind of cutting or burning is happening? And they see pictures of, losing limbs and things like that. Of course, that's not exactly what we're talking about here. Can you tell us a little bit about how laser can work in these different scenarios to help with things like erectile dysfunction, but also in the photobiomodulation side of healing tissue?
Sure. So there's two things that happen when we treat erectile dysfunction. Number one, as a man gets older, well, everybody, male and female, we start losing collagen. We stop collagen production. It's just an aging process. And up until the last few years, it's just been chalked up to, well, I'm getting older, and that's what happens. Your skin begins to fall, things begin to not work as well, and it's all. Here's what we've learned: is every cell in the body is regenerative, except hearing and vision. Every other cell is regenerative. So why don't we, instead of treat symptoms, let's treat the problems, and let's fix things and regenerate tissue. So by using a long pulse laser on the Nd:YAG side, we're able to treat both sides of the penis, treating the corpus cavernosum. The corpus cavernosum is a spongy material full of collagen that, as we deplete collagen, it develops what's called the venous leak. So you might be able to get an erection, but you're not able to keep it up, simply because there's no more restriction in restricting the vascularity flow out. So yes, it dilates vascularity, but it also remodels the collagen and thickens that collagen in the corpus cavernosum. So it actually, when it is erect, it's choking off the blood flow out until orgasm, and then it all releases and it flows out fine. So that's the first thing we're doing, is we're treating the collagen in the corpus cavernosum. The second thing we're doing is, because it's not very hot and high intensity light, it's able to turn on the stem cell flow and production, and you're able to release stem cells in the body through photobiomodulation. So, when you get injured, that's sometimes what happens. Your body releases stem cells. Well, we create a thermal injury that is not known to you. So you're not injured, you're not hurting, there's no pain, no numbing on this. It's very comfortable. And so that all begins to regenerate tissue. Then we do some other add-ons. I've got a patented shot. You've heard of the famous P shot and the O shot. I have changed that and made my own cocktail and have filed patent on that. And so we inject that along with the laser, and just getting tremendous tissue regeneration that's getting great results, absolutely great results, from old people to young people and everything in between.
Well, that's fantastic. I mean, that's stuff that sounds totally science fiction. I mean, if you would have said this to somebody, 10, 15 years ago, even, it probably would have sounded just crazy.
Absolutely. Look, 10 years ago, I've been in lasers for a while. 10 years ago, if you mentioned vaginal tightening or erectile dysfunction with a laser, people thought you were smoking dope. I mean, you were just totally off in left field somewhere. That was voodoo science, snake oil, doesn't work, whatever. And today, we just got so much science to back this up. I know I've been committed to research and science in this for several years now, going back quite a ways, to where it's seeing the results and the efficacy of the treatments. You just can't argue with it anymore.
That's pretty amazing. Now, I know we'll get some people who say, "Oh, well, my chiropractor has a laser. Is that good enough? Does that work?" So, I guess the best question would be, what does a patient need to look for when they're looking at specifically some of the sexual wellness techniques with laser?
it has to be a long pulse laser, meaning you be able to get into the seconds regime of the pulse duration. You cannot do this with most Nd:YAG lasers, are what we call, it's a long pulse, but it's in the millisecond pulse duration. And the one that I use goes from microseconds to milliseconds to full seconds. I can do a 20-second pulse duration if I want. I don't know what I would use for that, but the longer the pulse duration, the deeper the penetration of the light. So you're able to I can personally penetrate all the way to a femur, and treat a femur for 3 to 4 minutes and release bone marrow stem cells. I can go intraoral and treat the back of your throat and actually heat the amygdala and release neurocrest stem cells directly that way. All because of going into a 4 or 5 or 6 or 7 second pulse duration, low energy. I'm not using a ton of energy here. And you're able to just, interesting about biomodulation, if you put too much energy in, it turns off the modulation effect. If you don't put enough in, it doesn't turn it on. So you have to know, you have stem cell markers and know how to be able to do this and make it work. But it is extremely fascinating, and I just love what I do, and I love being able to help patients and hearing stories of, one great story I loved, 82-year-old patient, hadn't had sex for 20 years. His story, hadn't had sex for 20 years, and says in the last 3 months he's had sex 3 to 4 times a week with his wife.
Wow.
82 years old. So good for him.
That's fantastic. I mean, you think about the quality of life that you're talking about there. It's a huge increase in quality of life for somebody. And, that has some direct mental health effects for those people too.
No question.
That's awesome.
Question. Yeah.
Well, you mentioned there, even getting some light in some different areas. I know there are some treatments too that with laser that you can use for snoring. And we've talked about this in the past, but can you tell me a little bit about how the treatment for snoring with laser works? What kind of process is that?
So, again, snoring is a big problem with relationships today. It's a big problem with life experience and with the quality of life, because it affects the amount of sleep you get. You never get into that deep REM sleep that you really need to be in. So you're always just tired. And when you're tired, you just don't function properly, whether it's sexually, whether it's cognitively, all of the above. You just don't function properly. So again, using an erbium laser, a 2940 nanometer, but again, having an extra long pulse, a non-ablative pulse duration, you're able to treat the pillars and the soft palate and the uvula and posterior and anterior pillars, the tonsils, the soft palate, the uvula, and you're able to treat that area and get an amazing contraction and tightening. Now, it's for obstructive snoring. What happens is, again, as collagen depletes, that soft tissue begins to fall and relax in the back of your throat, and you get into a deep sleep. It vibrates, and there's your snoring sound. So we're able to tighten that tissue back up again, again, using thermal injury, treating the cytokines and fibroblasts and things like that. So you're able to produce new elastin and new collagen fibers and tighten that tissue up to where you're able to get free breathing. And then if you have a nasal snoring issue, we're able to also, with the same wavelength and the same pulse duration, we're able to shrink the turbinates by about 300-400 microns. So a breatherite strip gives you about 150 microns of clearance when you put a breatherite on. So when you're able to shrink up the turbinates just enough to double that of a breatherite strip, it really helps the airflow up the nose a lot. Again,
we're talking about shrinking. Oh, yeah. Sorry. Go ahead.
No pain, no numbing, no downtime on either one of these procedures.
That was exactly what I was going to ask. I was going to say, shrinking tissue, that sounds, I'm sure, to some people like a painful or invasive kind of process, but it actually isn't then.
15 minutes, you're in and out. The biggest effect I've ever had on anybody is they started sneezing pretty bad as soon as I started the treatment. It was a foreign tickle to their nose. Other than that, there's no There's no contraindications here. We have no issues here. It's very safe. It's very simple. Um, there's just people think, oh, is it going to change my voice? Is it going to affect? Am I going to get swelling? And no, none of that. Very comfortable. No, again, no pain.
See, that's pretty neat too, because you're talking about addressing the problem, the root of the problem, which is the slack in those tissues there in the back of the throat and the nose that are vibrating at night. You're actually reducing that slack. You're improving the tone of the tissues where they don't have that vibration, rather than something artificial like trying to, like you said, use a breathe right strip or have these other ways of approaching it that don't really solve the problem.
Correct.
That's awesome. So, we've talked on this podcast a lot about pain syndromes. We've talked about knee pain, back pain, headaches, things like that. What have you seen in your experience with utilizing laser therapy for pain?
Oh gosh, again, using that extra long pulse YAG with photobiomodulation, as well as just applying heat. Applying heat, you get tremendous fresh blood flow, and there's life in blood flow. New blood is new life. All the red blood cells breathe new life into everything. So my very best friend is a competitive CrossFitter. He's in the CrossFit Games regularly every year. And he had some micro tears in his shoulder that were just really a nagging, not really an acute pain, but just a nagging, always there, bothering him, not allowing him to work out as hard. And 3 treatments with the laser and some peptides, he was back in full swing, complete full swing. That's an injury. Okay. Then you have somebody with lower back pain down the small of your back, and you're able to use the long pulse laser there. And again, through just heat, basically it'd be like a heating pad on steroids, if you will, or just supersized heat placement, then or dispensation. So then you're able to put a lot of heat in, and then you can create the photobiomodulation effect as well for any damage or hurting down there. Arthritic pain, duplicate contracture. You're not able to cure contracture, but you can get 90% of the functionality back. And heck, with the surgeries, I've seen people have success with the surgery for 3, 4, 5 months, and then go to contract right back again. So you've gone through the pain of surgery, and there it is, where we can treat you every 6 months, and you have 95% functionality back in your hand without the pain.
Well, and I can say personally, I've seen a lot of downtime with those surgeries too. I mean, people unable to really do anything for a couple of months with that hand post-surgery, and then to have it go right back to the same, that's really awful.
Yeah, absolutely. Not only is it awful physically and mentally, you're just depressed about it. Can't believe it actually happened again. So again, I have to say again, what an exciting time to be alive. The science of laser medicine is more than alive and well. It's exploding. There's research going on around the world every day. And we have so many new things that we're working on that, once we get them perfected, we'll file for an FDA clearance and see what goes next. There's so many things that are happening.
It's awesome. It's exciting to be on the forefront and to get to talk to somebody like yourself who's been involved with this and so much experience too, to have you on. I will go ahead and I'd like to emphasize, we're not talking about any cures here when we're talking about these treatments. We're talking about addressing the symptoms, having good improvement functionally, oftentimes very long-term improvement. But we're not making any claims as far as cures or diagnosis, treatment, or vaccination or anything like that for any of these diseases we've talked about. Simply being able to address the way the body is working and have those good functional improvements. I think that's important to note, that we're, careful about staying within the FDA guidance there, of course.
That's very important. And I want to say that there's a big difference. I want to make sure people understand your point of curing something. The truth of life is we're all aging. And anybody that tells you that I can do a treatment, XYZ treatment on you, and it will fix the problem, they're lying to you, because what we're doing is we're regenerating tissue. That new regenerated tissue is going to deteriorate and age just like the rest of your body. So it's not a one and done ever. It's not fixing it. Now, if you maintain it, you can keep that in correction mode for a long, long time. But we're fixing damaged tissue and regenerating new tissue. That's the difference.
That's a great way to put it. That's so accurate. And your point there is good too. If you're a patient and you've got somebody who's over-promising some kind of cure or something like that, you need to evaluate that carefully. And if you have questions about treatment you're getting or treatment you're thinking about getting, I would encourage you to reach out to us. You can find us info@lasertherapyinstitute.org. And Dr. Nuziard, you might be available for questions if patients had them potentially.
Absolutely.
Awesome. That's great. So if you're looking for, especially on the tissue remodeling side and the sexual wellness side, highly encourage you to get a hold of Dr. Nuziard. Again, website is sexualwellnesscentersofTexas.com, but he's an absolute expert and he's tied in internationally, I know, with multiple other laser experts and laser treatment options. Also, you're welcome to get a hold of us too. Again, our email address, info@lasertherapyinstitute.org. Well, we'll go ahead and let you go for today, Doc, but thank you very much for your time. I really appreciate you coming on the show.
Thank you. I enjoyed being here, and anytime.
Awesome. Thanks.
Have a great day.
Subscribe to this weekly podcast for more great information. Find a certified laser therapy clinic near you at lasertherapyinstitute.org. If you're a healthcare provider, check out our practitioner-focused Laser Therapy Institute podcast. Thanks for listening.